So one of the most common questions I get as a male therapist is people will ask, why do I think men don't go to therapy? And while that's a really important question, I think what's sort of more looked at in the research and the way that we can support men better is we have to ask, why don't men ask for help? And that's the key to understanding not only how we treat men in therapy, but also how we as family members can support those men in our lives that might be feeling depressed or anxious or stressed. Hi, I'm Danny Clark. I'm a licensed clinical social worker and family therapist in Houston, Texas. So let's look at a little bit of the research. So some of the more recent research that's come out looking specifically at, say, men's depression has found that as men's depression starts to increase, so does the feeling of loneliness. Now, that's irrelevant to the number of friends they might have or their social network. It's just the feeling of loneliness. And that feeling of loneliness then leads to men not asking for help. And that non-disclosure of how they're feeling will then turn and increase their depression, which then increases that loneliness. And as you can see, there's this vicious cycle that can occur. And one of the things the researchers and research throughout has found is that masculine norms have a big part of playing as far as a barrier to men seeking treatment and asking for help. One of the things that we can consider a masculine norm is that it's what we would call a cognitive dissonance. So cognitive dissonance is a psychological conflict that arises when your beliefs and actions don't quite align. And for many men, traditional masculine norms emphasize self-reliance, toughness, and emotional restraint. But when they're struggling with depression, these very norms create an internal conflict. They know they need help, but they've been taught that asking for it is a sign of weakness. And so this belief that men should be vulnerable clashes with the reality of their mental health struggles. And the dissonance itself often leads to silence, isolation, and worsening depressions. But here's the thing. Masculinity isn't a fixed set of traits. It's not just about being stoic or always tough. Masculinity can and should be restructured. It can include vulnerability, the strength to ask for help, and the courage to face your mental health head on. So imagine if we redefine what it means to be masculine, if we viewed asking for help not as a weakness, but as a true form of strength. By restructuring our ideas of masculinity, we can help men break out of the cycle of cognitive dissonance, isolation, and deep depression. You see, research supports this. When men feel that they can align their actions with a healthier, more flexible understanding of masculinity, they're more likely to seek help and less likely to suffer in silence. So how can you help the men in your life? Well, we can start by reframing our own ideas of what masculinity is. And this doesn't mean that masculinity has to change as far as strength and courage. It just means that we want to encourage the men around you to see strength in their emotional awareness and bravery in asking for help. And by doing this, we can begin to dismantle those harmful norms and create a culture where men feel empowered to take care of their own mental health. So as you can see, answering the question of why men don't go to therapy can be rather complex. And when we look at a lot of the research and a lot of the way people talk about it, it really is kind of stigmatizing when we tell men that men don't go to therapy because they don't ask for help. When the reality is that everyone has a part to play in how we understand asking for help and where do we see the strength in doing so. And so if we want to be able to support men, both in our families and in our therapy rooms, we have to understand that how we think about masculinity also makes a big difference, especially when it comes to mental health. So I hope that gives you some insight into how that question gets answered. And there's still a lot to learn, but at least we're still trying.